Hello guys, welcome back to the channel. My name is Gabriel and I'm an Epic analyst working at one of the top research hospitals in the US. If you're new here, I make videos to help healthcare professionals transition into EHR roles such as Epic. In today's video, I will be reviewing a startup's EHR and giving my thoughts on how an Epic analyst looks at EHRs. If you find this video helpful, please leave a like and subscribe, and I'll see you in the next video. Hey guys, okay, before I start reviewing this EHR, I wanted to take you through an overview of what this EHR will be doing. So this is a simple EHR that just focuses on any like regular doctor visit where you see a primary care physician and things like that. So I just wanted to take you through this workflow. So I just wanted to show you this. So I just wanted to show you this diagram for you to understand what's going, like what the software does. So before the patient even arrives, we need to be able to schedule their appointment, and to do that, the EHR will have to have a functionality for scheduling. So in this section up here, we have two things that go into scheduling. That would be the visit type and the date, time, and place. So the visit type can be anything from a routine yearly checkup to something specific, like if you're having issues with a specific thing that has been bothering you for the past few weeks, and you want to bring that up with your doctor. For an example, this could be like an ear infection. Based on the visit type, things down here would also update based on what's chosen for this. That's why this is very important when creating an EHR. The date, time, and place obviously is important as well, since we want to give the patient instructions on what time to arrive to the appointment, where it is, and the date, right? This insurance part, I'm gonna go in depth another video. There's a lot going on here with pre-authorization. Clinical instructions can be part of the scheduling part. A lot of times, to save money, healthcare organizations don't hire someone that has clinical background to do the scheduling portion, since this can be done by anyone. But the insurance part, we do need to have someone with clinical knowledge to be able to assign correct ICD-10 codes and any other information relating to the patient's overall health. Okay, so once we got this scheduling part done, patient has an appointment and the date, and we know what the visit type is. Then the patient arrives for their appointment at that physical location. So this is the patient arrives part of this workflow. Once the patient arrives, they check in. There's a lot of stuff going on in this area too here that I will not be going over in this video. But once the patient arrives, then they wait, and then an MA, a clinical assistant, or a nurse, they take the patient's vitals. So they get either the blood pressure, height, weight. There might be more things. I'm not clinical, but I know these are very common. And they also have clinical questions for the patient. In this part of the workflow here, the clinical person asks clinical questions that is related to the visit type to then help the provider have the background data on what they should be doing with the patient in terms of diagnosing or creating referrals, things like that. Sometimes there's also forms to fill out before you are seen by your provider. So some yearly forms are like depression screening. I think it's called like PHQ-9, something like that. There's also specific forms based on the visit type that you would be filling out for the appointment. So that's that part of the workflow. And then we get to the doctor sees patient part. So this is the part where the doctor has your information or your appointment on his scheduling system or on his schedule. He sees your name, you're up next for him. And yeah, so I just want to give you guys this background before I showed you the EHR. It would just help you, it would just show you the flow of what I'm talking about. This is clinic, and I'm just going to let this play for a little bit so you get a little background on what's going on.
So this is where we ended up, or this is a new version 2, if you will, of the appointments feature. Now this is a little bit different. There is a little bit more of a UI in this sidebar. But what you can see is I've broken it down and said, okay, every appointment gets the appointment length, right? So that's very similar to a lot of these calendaring apps. That should not be a huge surprise. I've also included a little bit of metadata information. So each appointment block is a little bit bigger so that we can include some information about the appointment. Things like which exam room that person is in, maybe the status, maybe the type of appointment. There's actually plenty of room here to include other things as well. So there could be some other information here as time goes on. And so this is, I think, a much simpler version, essentially, of this view. This gives the user a 2 to 3 hour block, depending on the size and exact kind of heights and things here. It gives the user a 2 to 3 hour block of window, essentially of like, okay, here's what's happening in the next couple hours. And that gives them then the ability to go in and look at a person. So they could click on a person and see, okay, here's like this, they could click on it, that gets highlighted a certain way, and then boom, they're seeing that information about the patient.
So that gives you a little introduction on what this EHR looks like. And I just wanted to give you guys a little background on how an Epic analyst brain would think whenever seeing anything that's EHR related. So the first thing that I would notice is to figure out what we are doing, what activity is going on in the screen. So based on this section right here, it looks like we are in the appointment activity. So this appointment activity leads to this whole activity, okay, whole blue thing. So if we click on a different one, then it would be tasks inbox. We would see a different screen based on whatever we click on there. Okay. Now this appointments activity also has different sections inside. So the main three sections that I see are this one right here, which shows the patient visit types, right? So this little box right here is a visit type. This is also another visit type. So by the looks of this shows that this EHR is showing us the visit type of the patient scheduled, as well as the room that they are scheduled in. So it looks like this one's scheduled to room 1, and then this one's room 2, right? And then the other section here in the middle, we can see that we can see the information of this specific patient right here. So this Priscilla patient is here in the middle section. So from here, the provider can see a summary of the patient, like the reason why they're coming in. And this section here could probably be taken at the scheduling part of the whole process. The chief complaint would have to be completed by someone that's clinical, right? So this could be taken by the MA nurse or whoever saw the patient and just enter this information. And then this is the vital sign section that I was talking to you about earlier. So this was also taken during that workflow. And then you can also see information regarding their recent events, which looks like they had labs done, and also this is the meds. They want this med refilled, or it was refilled a month ago. So I really like how this flows, since, like I mentioned before, we usually see things from left to right, or we read things from left to right, and this is something that's natural for someone using an EHR, to just start from the left and then go to the right. And then we have an additional information here regarding the active conditions of the patient. So what, like the problem list. So this section would be like the problem list. Maybe I would reword this to problem list, since that's usually the preferred name for that. And the last appointment, you can also see when the last appointment was. Right, so I'm just going to change the color of this to make everything so green. So I would update this to say problem list, and then this is fine, the last appointment. And then on the top here, we can see the patient's MRN, date of birth, and insurance. We want to double check this every time in the workflow. So whenever you're scheduling the patient, you would want to double check you got the right MRN, date of birth, and name. And you also want to check this when you are getting the clinical information from the patient. And you also want to check this at the point of, as a provider, right? You're seeing your patient, you want to make sure you have the right patient. So I would actually bold this to make this information just pop in the screen and not be missed, since that's the most important part. You want to document on the correct patient. So overall, I think this is a great design. So I think he works in UI and UX, and it shows, honestly. Like this whole thing, it's so user friendly, it's easy to follow, and you're not overloaded with information. So I honestly think he's doing a great job. This application. So of course, this application is not meant to be used for huge health systems. He's making this EHR application for small clinics that don't really require big integrations of applications, such as integrating a cardiology application, radiology application, a billing application. Although he does have a billing section here, just having all of them connect is the hardest part. The integration to make it all seamless is the hardest part. And it looks like this is pretty clean overall as a EHR application. And yeah, so if you're a clinician and want to help out with workflows and things like that, he is accepting one-on-one calls to to help him out on making this better, I will put his information in the description section for you to check him out. And he also has a current prototype for testing if you would like to play around with that. So this was today's video. If you found any value to this, and if you have any questions or any comments, please leave them down in the comment section. I respond to every comment from you guys. I'm also going to start posting new Epic Analyst positions in my website. I've been having issues with YouTube's community section where I usually post new Epic job posts. So I will be listing those in my website for you to check out. So these Epic job posts are entry-level analyst positions, some Epic training positions, and so I actually go through each healthcare organization's website in the career section that use Epic to find these job posts for you guys. So if you have not been looking at those yet, feel free to check them out. A lot of them are going to be gone fast since they are giving out certifications to people. So that would be in our epicjourney.com website. I will link that down in the description as well. But again, thank you guys for watching, and I'll see you in the next video.